Introduction. Panama has a classic social security system, which is run by the CSS hinged on two legal frameworks. These frameworks include the National Constitution and Article 109, and they underscore the citizens' entitlement to Social Security. In addition, the frameworks define the citizens' right to the organic law of the CSS. This law is mandated to guarantee financial sustainability to the aged, the disabled, and in cases of death. In addition, the law authorizes the CSS to avail prophylactic services coupled with ensuring smooth running of activities within the Ministry of Health. The CSS programs are utilized only in cases of emergency like during an outbreak. The healthcare system. According to the CSS Department of Planning, 2,651,510 beneficiaries, or 75.6% of the population, were registered with the CSS in 2010. The health system is a constituent of both the private and public sectors. The Ministry of Health together with the CSS forms the bulk of the public sector, accounting got around 90% of the entire population. The Pan American Health Organization records, the system is organized into 14 health regions, including two recently created ones, the Aragon and Northern Panama Health Regions. 909 disparate facilities make up the network. However, the network's facilities and human resources are distributed unevenly across the region, and thus the majority of them are found within the urban centers. In addition, the disparate constituents within the system execute overlapping duties and service provisions, and thus they end up creating unnecessary competition and conflict of interest courtesy of unclear definitions and separation of functions. This clash and confusion breed poor leadership, inequality, and heightened costs. Panama has increasingly adopted modern information management tools in the healthcare sector. Advantages of Panama's healthcare system. Panama has a few private hospitals that offer excellent services and medical attention within modern facilities. The private hospitals are at par with other Western countries' medical facilities. Most private hospitals in Panama City are affiliated with the United States medical schools, such as Punta Pacifica, which is a Johns Hopkins affiliate, San Fernando is affiliated with Tulane, and Centro Medico Patilla, which is affiliated with Cleveland Clinic of Cleveland, Ohio. The costs of medical care at private hospitals or doctors' offices in Panama are significantly cheaper as compared to their counterparts in the United States. For example, an emergency room visit in Panama will cost about $100, and a consultation with a specialist will be around $50. The citizens enjoy free public health care. The government is investing millions of dollars to improve public hospital infrastructures. Disadvantages of Panama's healthcare. Public hospitals do not offer excellent services, and thus mostly, Panamanians have to wait for several hours to receive medical care even in the emergency rooms. If one has health insurance cover or the means to pay in cash, it is highly recommended to seek services from private hospitals. Public hospitals lack enough doctors to take care of all of the patients. Access to health care. Health Access Panama will be available via two main channels of distribution, viz. Through commercial sales efforts to Panama's leading employers and consumer-driven marketing and advertising campaigns throughout the country. Employers have shown enthusiasm in offering the program to their employees. By taking advantage of corporate discounts, they are in a position to include the plan as part of a value-added benefit that significantly increases the overall compensation packages that ultimately yield increased loyalty and productivity. Internacional de Seguros, which is an insurance carrier in Panama, recognizes the merit of such an all-inclusive platform, and it has collaborated with Health Access Panama to market the program to both existing and non-existent clients. In addition, other available arrangements include systems for the management of humanitarian supplies, audits of files, registering suppliers and making their catalogs available, health records, and personnel registries, making it possible to have the CVs of physicians and technical personnel online. Panama is classified as an upper-middle-income country. Slightly over half of its population is concentrated in the two largest cities, and its population structure has started to resemble that of developed countries, with a larger proportion of adults and elderly, and a smaller young population. As to mortality patterns, chronic diseases are dominant, except in the indigenous comarcas of Gunayala and Gibabugle, where infectious and parasitic diseases continue to be the leading causes of death. The country spends a substantial and rising percentage of its GDP on health. However, out-of-pocket expenditure continues to be a hefty proportion of total healthcare spending, 30.7% in 2010, and social spending on health as a percentage of all public social spending has declined in comparison with 2005. In the future, by realizing fully the Strategic Plan of Government 2010 to 2014 Z fully, it will underscore a major step toward reducing health inequalities in Panama. The strategic plan has two key priorities, viz. Formation of human capital for development and social inclusion. The social inclusion component encompasses reducing malnutrition, expanding drinking water supply systems, increasing the coverage and quality of basic health services, ensuring access to decent housing, establishing a safe and efficient public transportation system in Panama City, instituting preventive measures for citizen safety, and strengthening the social protection system. In addition, few companies offer Panama the introduction of medical drugs to accomplish the country's needs. Quah Pharmaceuticals is an international distribution company with headquarters in Montreal, Canada, an operating subsidiary in Mexico City, and distribution partners in several Latin American countries. Its main business focus is to distribute pharmaceutical and healthcare products in Latin America. The Panamanian Ministry of Health approved registration number 61523. Conclusion. Panama, which is a Central American country, depends heavily on its privileged geographical position. More than 3/4 of its GDP is derived from the well-developed services sector. The Panama Canal is scheduled to expand significantly and double its capacity by 2014, while a unique United States dollar-based monetary regime has spurred growth in the banking and insurance sectors. The Cologne-free zone, the logistics industry, the flagship registry, and tourism also contribute to the country's economic performance. However, the strong economic performance has not translated into broadly shared prosperity, and thus Panama has the second worst income distribution in Latin America. About 30% of the population lives in poverty, even though the country experienced a drastic 10% drop in poverty index between 2006 and 2010. Following a similar pattern, unemployment dropped from 12% to less than 3% of the labor force in 2011. A United States-Panama Trade Promotion Agreement was approved by the United States Congress and signed into law in October 2011. Seeking removal from the Organization of Economic Cooperation and Development's gray list of tax havens, Panama has also recently signed various double taxation treaties with other nations. StudyCorgi.com has everything you need for successful studies. Writing tools, informative articles, and essay samples. Come check it out!